We want to see more of this coming.
All right, thank you very much. And finally, President Bola Tinubu approved the employment of 774 National Health Fellows, an initiative under the Ministry of Health designed to revitalize Nigeria's health sector. The employment of the fellows selected from each local government area in the country came from the recommendation of the Coordinating Minister of Health and Social Welfare, Professor Muhammadu Ali Pate. The fellows are to monitor primary healthcare centers across all LGAs and expected to drive meaningful changes in healthcare delivery in Nigeria. Justice Ojena, the President approved 774 National Health Fellows, the best selection from over 360,000 applicants, underscoring the merit-based nature of the process as recommended by Professor Ali Pate. Now, how laudable is this?
I think it is, to say it's laudable is an understatement. It is very, very direly needed and necessary, especially because of the brain drain that we have actually been suffering in that space. And I went through the resume of what it would take to become a health fellow. It's daunting. It's really, really daunting, and it's channeled towards the youth. It's very, very, there's international development associations involved. There is this, there is that, in order for you to even be able to qualify. And this one is, I think this heat is one per local government.
In fact, I saw the video when the president said, you all are hired, and the whole room erupted in joy.
Yeah, if you spend so much money, it's just like an average Navy SEAL, for example. You spend $3 million to train a particular SEAL.
I'm telling you.
You can't fire them. You can't easily let them go.
Absolutely.
So much has been put into them, and they also know that they hold a position of privilege, and a very, very rare one indeed. To be a professional selected in a whole local government is no mean feat, and they should hold their shoulders high, and they should do their job with so much pride.
Thank you very much. Well, Adams, very quickly, with over 60% of Nigerians under 30, we're looking at one of the most energetic, resourceful, and dynamic youth populations globally. Now, how can we sustain this initiative to achieve the desired gains?
Yeah, healthcare delivery is about one of the core functions of government. Nigerians are entitled to good health. They're entitled to modern health facilities and health deliveries. So we have seen the initiative by the president is a novel initiative that demands that the youth, that have the vigor expected of this responsibility should take advantage of. And we have seen that Nigerians have a very robust youth population, where our youth population is enviable everywhere in the world. So it is the best, an appropriate opportunity for government to tap into this, comparative advantage and make the youth, a fulcrum of healthcare delivery, especially to the grassroots. It's a novel initiative. It is an initiative that has succeeded in certain other countries, in Asian countries like India. India has taken advantage of their youthful population in similar regards and enhanced healthcare delivery. So the same thing can actually be replicated in Nigeria for the benefits of every Nigerian.
All right, thank you. Thank you. Now, just as quickly, you made mention of the brain drain. Now, should we now begin to think forward in trying to adopt these initiatives into law so as to sustain a structure and put Nigeria on the map? Because if we have initiatives from individuals like the president, and maybe another president comes into power and decides, I have an idea, and they collapse that idea and they want to do their own, don't you think it's time we begin to close up some of these initiatives, make it law, so that anybody that is coming into power also will continue on that terrain and put the country, on the map?
Okay, for me, yeah, I think that's a very, very great idea, but there will be a snag.
Okay.
I say it's a very, very great idea because one example of where that has been implemented is when we talk about medium-term expenditure framework. We are not just only talking about annual budgets. We are talking about budgets for 5 years, budgets for 10 years.
Yeah.
So that can be brought into play in this. But when it comes to passing law in order to bind the future president or future legislatures, we usually say in constitutional law that no legislature can bind the future legislators or the future legislature. So it's a constitutional law issue. Any government or any law that purports to do such a thing will find itself.
But you just said it's a good idea.
Yeah, it's
fantastic idea.
Yeah, it's a fantastic idea.
How do we progress if laws like this are in place?
It's a fantastic idea, but the next legislature, for example,
might not dig
National
into it.
Assembly,
might not buy into it.
Yeah, the 11th house or 12th house or 13th house may just come and say, no, we need something better. We cannot continue with it. But let me draw an international parallel.
Okay.
Obamacare, Medicaid, Medicare. Donald Trump has been trying everything he can to actually bring it down. The last time when it was voted down like this by Senator McCain, it was because at the time when Obama passed it, they had the number of legislators required to amend it. But till now, Donald Trump has not been able to summon the number of legislators that it will require to amend it. So maybe, yes, let's have something like that in law, but will the next president, but in Nigeria, we seem to have a situation where the president can practically summon the number of legislators he wants to be able to upturn a law. So I suspect that the next president too will be able to summon the numbers in the legislature and pass the law that will amend it.
All right, now, Adams, very quickly, that the president said the National Health Fellows Initiative is part of several platforms provided by his administration to empower Nigerian youths. In your own stride, how do you think we can adopt other measures to ensure that the young people of Nigeria are kept happy? Because from the look of things, a lot of them are giving up, and that's why they're leaving the country to go seek better life elsewhere.
Yeah, you know, my co-discussant has mentioned a very strategic point about addressing the brain drain, especially in the health sector, through the president's initiative. You know, you have asked how the youths could be productively engaged in other sectors. That's what I understand from your question.
Yeah.
You know, Marriott, there are a lot of opportunities where the youths of Nigerian youths could be, you know, productively engaged. We have the National Population Census that should take statistics on population, growth around the country. Take statistics on demography. You know, the youths they could bring their vigor into play in harnessing and in addressing our national challenges. We have environmental issues, you know, environmental impact assessments, you know. The youths could actually be engaged in these, areas, you know. Their intellects could be brought to bear. They have that strength that could drive any sector, could drive development in any sector, you know. So we have an opportunity where, opportunities, a lot of opportunities where the present administration could tap into this robust youth population and then engage our youth. This would, address the important question of brain drain and of intellectual flight, you know.
Thank you.
Thank you.
Thank you very much. All right, thank you very kindly for turning up on the show today. We appreciate your contribution.
Thank you very much.
All right, Justice, it's been a pleasure. Always. Always. Thank you very much. And that's our show for today. Remember, you can follow the conversation on our social media platforms at TVC News NG or on our website at tvcnews.tv. I am Marco Tabo. Until next week, goodbye.